At first glance, drawing blood may seem like a simple routine procedure. But let me ask you a question. Can a laboratory give accurate results if the blood sample itself is collected improperly? The answer is no. Even the most advanced laboratory equipment cannot correct errors made during sample collection. Therefore, proper technique in blood collection is absolutely essential for accurate diagnosis, patient safety, and effective clinical management. Let us begin by understanding why correct blood collection is so crucial. Blood is collected for various hematological investigations such as complete blood counts, coagulation studies, blood sugar estimation, and many other diagnostic tests. The laboratory results guide the clinician in diagnosing diseases, monitoring treatment, and making critical decisions. Accurate samples lead to accurate care. So, we must follow these steps to ensure the blood sample is collected correctly. Step 1. Confirm patient identity using two identifiers and obtain informed consent before proceeding. Step 2. Perform hand hygiene and put on clean gloves. Maintain aseptic technique throughout the procedure. Step 3. Assemble equipment, needles or Vacutainers, collection tubes in correct order, Tourniquet, alcohol swabs, gauze, and labels. Step 4. Position the patient comfortably with the arm supported and exposed. Ask the patient to relax their hand and fingers. Step 5. Select the vein by inspection and palpation. The median cubital is preferred when accessible and visible. Step 6. Apply a tourniquet about 3 to 4 inches above the puncture site, but release it if inability to draw quickly is anticipated. Begin by cleansing the site with an alcohol swab using concentric circles from center outward and allow the site to air dry. Anchor the vein by placing the thumb of your non-dominant hand below the puncture site and pull the skin taut. Insert the needle bevel up at a shallow angle of about 15 to 30 degrees smoothly and confidently into the vein. Once blood flows, attach collection tubes in the correct order of draw without removing the needle, allowing each tube to fill to required volume. Gently invert tubes that require mixing immediately as per tube instructions to prevent clotting and ensure additive distribution. When required volumes are collected, release the tourniquet, place gauze over the site, remove the needle smoothly and instruct the patient to apply pressure. Immediately label each tube at the bedside with patient identifiers, date, time and collect initials before leaving the patient. Verify labels match the requisition form. Mismatched or unlabeled samples must never be accepted by the laboratory. Dispose of needles immediately into a puncture-resistant sharps container without recapping. This prevents needle stick injuries. Apply a secure dressing and ensure the patient is comfortable. Provide aftercare instructions including pressure and when to seek help. Transport samples to the laboratory promptly using appropriate containers and temperature controls as required by test type. Document the procedure including any difficulties encountered, complications, or specimen remarks in the patient record. If a vein collapses or flow is poor, withdraw slightly and try a new tube or reposition the needle. Do not force blood into the tube. Avoid repeated probing of the same site. If multiple attempts fail, seek assistance from a more experienced colleague. Watch for signs of hematoma. If one forms, stop immediately, apply pressure, and document the event. Prevent hemolysis by using proper needle size, avoiding excessive force, and minimizing prolonged tourniquet time. Safety reminder: always follow institutional infection control policies, dispose hazards correctly, and prioritize patient dignity and comfort. And that wraps up today's topic. If this explanation helped you understand the concept more clearly, make sure to like the video and subscribe to ParamedIQ for more simplified lab technology and radiology lessons powered by AI. We break down complex subjects in hematology, biochemistry, microbiology, pathology, X-ray, CT, MRI, and diagnostic imaging step by step. So you don't just memorize, you truly understand. If you have any questions or want a specific topic covered, drop it in the comments below. Until the next video, keep learning smart, keep thinking critically, and keep mastering diagnostics.